Is it okay to take prednisone with Benadryl? Is this a drug interaction or is it okay? Hi, I'm Dr. Megan, your prednisone pharmacist, and I'm an expert on prednisone, and I looked this drug interaction up to see what are the risks. And what it showed was class level A, no risks. But I want to make sure that this is given with the full clarity that you need to know if you're planning to take Benadryl with prednisone. And I can totally get why you'd want to take Benadryl with prednisone. Two reasons. First, prednisone causes insomnia. Insomnia is the number one tweeted side effect of prednisone. And so Benadryl can help you feel drowsy and get some sleep, right? Not the best quality sleep, but at least get the drowsiness to make you want to sleep. So I can see that you'd want to take it for that. Or the second reason is if you're taking prednisone for allergies or something like that. Benadryl is technically an allergy medication. The generic name for it is diphenhydramine, and you can buy either of them. Diphenhydramine is a common ingredient in cold and flu remedies. So I get it. Why you'd want to know, can you take prednisone and Benadryl? But there's some people who should not be taking this combination just because of the risks of Benadryl itself. So the most people who take prednisone are older people, and the people who should not take Benadryl are older people. If you're over the age of 65, they created a list of drugs called the Beers list of drugs that those over the age of 65 should not take or should take with caution and definitely talk to their doctor about. And one of those is Benadryl or diphenhydramine. And the reason is because the way it works. I'm going to just read this straight because it says it the way I'd like to say it anyway. Diphenhydramine is an anticholinergic, which means it blocks acetylcholine, a neurotransmitter that helps control memory, learning, and muscle contractions. Do you want those as you age? Memory, learning, and muscle contractions? As people age, their brain's ability to use acetylcholine declines. So reducing it further with these drugs can cause problems. For example, healthy elderly volunteers have shown significant psychomotor impairment after taking dosages higher than 50 milligrams of Benadryl or diphenhydramine. The typical dosage for an adult is 25 milligrams. So to get 50 milligrams, you'd have to be taking 2. So taking 2 or more can really slow down your brain, your thinking, your memory, your steadiness, your ability to walk. It can dry you up, meaning it can dry up your tears or make it harder to be continent. We don't want any of those issues. So for those who are over the age of 65, because it can increase your risk for falling, increase your risk for having urinary issues, increase your risk for memory issues, it's best not to take Benadryl at all, whether with prednisone or without prednisone. Just Benadryl is not safe over the age of 65. If you're having trouble that you need something like Benadryl for example, you're having insomnia, there are other methods that are safer for people over the age of 65 that I recommend you discuss with your doctor while you are planning to take Benadryl if you're over the age of 65. And if you found this video helpful, please like this video. And if you have taken Benadryl with prednisone, please let us know what your experience has been below. Signing off is Dr. Megan, your prednisone pharmacist.